Hi, my name is Annie Lesperance. I am an RN working in Wilmington, North Carolina in a pediatric clinic. I have been with this clinic for 3 years this summer and absolutely love working in pediatrics. I would say my favorite part of my job is working with the newborns and the mom and dads and seeing them and how excited and happy they are, and just it's such an amazing experience. I'm very interested in breastfeeding and working on lactation, which brings me to my short-term goal. I will be taking a class in July. It's a lactation course, a week-long course in Jacksonville, North Carolina, and my hope is to pass it and become a certified lactation consultant. And as a long-term goal, I would like to become IBL-CE certified and work as a lactation consultant and a pediatric nurse, and just be able to provide my patients with knowledge with helping with nursing if they want to go down that route, and support them and educate them, and just be there for them if they need, and encourage them along that path. As far as positive and negative experience I've had with the nursing managers, the negative experience I've had would probably be with my first nursing job. I worked at a skilled nursing facility on a rehab unit for 6 months. I was hired by a manager, and I had a great interview with her. However, once I got the job and started, I was thrown into the position with only 3 days of training by another new nurse. She basically just trained me to the med cart. She didn't really have a clue as to many things. We had some pretty high acuity patients that were coming in that I felt was kind of out of my realm of skill level at that point and knowledge base. So I had to go to another nurse that worked with me on evenings. She was on the other side of the rehab unit, and she was an LPN who's has worked for over 20 years. And she was a wealth of knowledge to me. She was so smart and kind and generous, and she taught me so many things, so many things. She was a great resource to me and a great friend, and encouraged me every day. Without her, I don't know if I would have made it there the 6 months that I did. And with her help and knowledge, I learned a lot, and so that was great. But the manager, she didn't really help. I went to her and I tried to explain to her that I needed some more training, that, especially with these high acuity patients, she really needed to provide some more training and not just throw new nurses in, that we need to be with another skilled nurse to, properly be able to care for these patients. But she didn't really listen. They had such high turnover rate, and there just wasn't the time or the resources available. My positive nursing manager would be my current manager. She's great. She has a really great open door policy. She provides great training. We received like 3 months of training, and at the end of that, if we didn't feel comfortable, she gave us more. She always listens if you have concerns, and she always makes time to talk to you, whether you call, email, want to step into her office. She's just very kind and smart and upbeat, very happy and energetic, and just always has a smile on her face, and it's really great to see. And she makes our work environment very positive, which I love, because we work in pediatrics and you have to be positive and upbeat and happy. Nice meeting everybody, and I look forward to being in class with you. Thanks.